morning, everyone. Thank you for coming to this awesome event. We have a significant number of individuals that would like to say a few words, so I would like to start this off with Mayor Jake Day to welcome everyone and give a few remarks.
Thank you so much, Lori. Well, good morning, everyone. It's a joy to be here with you. As I was just saying, this is a topic that is certainly not a topic I'm an expert in. But this is something that has been an idea, a concept, and an interest of the city of Salisbury and our fire department, as well as our friends at the health department and at Peninsula Regional Medical Center. For about 2 years now, we've been talking about this. I remember driving down the highway one day, listening to an NPR story about Houston, Texas, and how they were cutting the number of EMS calls and cutting the number of emergency department visits and cutting the costs of running each of those business units. And I thought to myself, well, I haven't seen the costs of any of those things decline in my short time in public service. So we've got to look into this. And we are incredibly blessed to have PRMC, and whose president is here with us today, President and CEO Steve Leonard. We are incredibly blessed to have you and your team here in our community and to have such an open and willing partner who wanted to work with us on this endeavor. So it's important to note that Salisbury Fire Department in the Salisbury Fire District has over 2,000 non-emergency calls for assistance every single year. 2/3 of those calls result in transport to PRMC's emergency and trauma centers. And it is our endeavor through this project, through a mobile integrated healthcare project, what we call SWIFT, Salisbury Wicomico Integrated Firstcare Team. It is our endeavor to reduce the burden on both our EMS services and on our emergency department. And I think the reason why, and we all have to remember this, the reason why it's important that we reduce those burdens is not only because we're in tight budgetary times, both in healthcare and in the Salisbury Fire District. But it is also a moment where we want to ensure that we are providing the best service to those who absolutely need it when they need it. The absolute best and fastest service to those who need it and when they need it. And by reducing the burden on the system through non-emergency calls, we are not only helping people in their home where they need it most, and in some cases helping their access to their own understanding of healthcare, of their healthcare, we are also helping to ensure that all those people who pick up the phone, dial 911, and expect quick response are getting it, and they're getting that best care. So, with that, it is my honor today to stand here with our partners at Wicomico Health Department, our partners at PRMC, but I also want to state earlier last week, we were lucky enough, Dave Phippen and Chris Truitt our team was able to go up to the Maryland Institute for Emergency Medical Services Systems Award Ceremony and receive an award for this great work. So to the SWIFT team at PRMC, Wicomico Health Department, and Salisbury Fire Department, we say congratulations on that award. So, we have some very important people here with us today. I'm going to hand it back to our master of ceremonies, our mistress of ceremonies. We weren't quite sure what it's called. Lori Brewster. Thank you, Lori, again, for all your work and your team's work, and we appreciate you.
Thank you. So I want to recognize a few individuals that are in our audience. We had a few individuals that were unable to attend. We do have Delegate Mary Beth Carroza, who will be presenting some information in a few moments and have a few words. And Delegate Cherie Sample Hughes will also be providing some few remarks. We also have our County Executive, Bob Culver, and our City Council President, Jack Heath. Thank you all for coming. It is such a pleasure to be a part of this endeavor. I think David Phippen and I have grown very close by email and telephone over the course of the last year. We had received some funding from Care First to kick this program off, and you'll hear from the Care First representative in a few moments. But we saw some really good outcomes for the first 6 months of the fiscal year. So we're really pleased that the Commission has provided some funding to continue this service, with our hopes that this will become a billable service for our EMS unit in the very near future. That is my goal, and I had actually had some dialogue this morning very early with our Deputy Secretary of Public Health, who is pushing this through the Medicaid system. So I'm hopeful that it will not take as long as I anticipate, but we will have it done sooner than later. So next on the agenda is Rick Hoppus from the Salisbury Fire Department. He is the chief for a short period of time. More?
Thank you, Lori. It's a pleasure to be with everyone today. This is a great occasion to celebrate successes, and more importantly, to celebrate partnerships. These public-private partnerships are always a win-win for our community. And as stewards of our citizens' money, it's important that we all look at ways to accomplish the mission in a way that is more responsive to the needs of the citizens, as well as more fiscally responsible in the way that we expend their money. In this particular case, this was an idea not generated by the city of Salisbury, but certainly copied and mirrored by many jurisdictions across the country, as we have tried to model our SWIFT, or mobile integrated healthcare response, with best practices across the nation. And we have some examples within our state that have been pioneers that have gone before us to accomplish this mission as well. So we've kind of taken that collaborative approach to mirror and mimic best practices as best we can. And what a great opportunity it has been for us to broaden our scope of responsibility, to even broaden our focus into community health with our partners from the Health Department and PRMC, finding out that we're not the only players in the game, and by doing so, making sure that all of our partners are feeling the overall success of the initiative. We're so very grateful for those entities that have provided funding for us. It's extremely important for us to receive that funding in order to make sure that these kinds of initiatives move forward. Even in its infancy, it was a struggle to try to figure out how we would fund this initiative. But fortunately enough, we've been awarded several things that have helped us do that without fail. Grateful, I can't tell you how grateful I am for the members of the Salisbury Fire Department, that really have been at the tip of the spear pushing this forward. We the face of the program for us is firefighter paramedic David Fippen, but he had a lot of partners within the organization to help at the very grassroots level to get it going. We express our gratitude to them. With that, so that I don't miss anybody, I'll just say thank you to all of those members who were participating in that. But obviously, it's because of their efforts that we stand here today. So we're grateful for the partnerships. We're grateful for the successes that we have, and more importantly, we're grateful for the ability to provide the right care, the right type of service at the right time to the right people in their time of need. Not expending resources over and above that which is required, which is really what this initiative is all about. We provide the right care at the right time for the right people in the right place, and that's really the goal, and we're grateful for the successful outcomes we've had to date. Thank you so much.
So our PIOs do a very good job at organizing the events and providing an agenda, and I didn't go by the agenda. So I'll go back onto the agenda. I would like to invite Delegate Carosa up to offer a few words.
So good morning, everybody. I am really excited about this invitation because I know whenever the Maryland Community Health Resources Commission and the Wicomico County Health Department partnered with Salisbury Fire EMS and PRMC and our private sector partners as well with Care First that we are on the right path to a true partnership with real results. And when I think about this, when we think about how this partnership works, those of us who are in a position where we work with the commission, and I'm happy to say I've worked with this commission since my first year as a delegate. I'm on the subcommittee that oversees the Health and Human Services. So I want to publicly acknowledge Mark Luckner's and Dr. Anderson's role. They've spent time educating us on what they can do, but basically what they told me 4 years ago is that, you know, we will fund projects where there is a true public-private partnership with results. And if you think about it, they've been friends to the shore. We've had the Lower Shore Enterprises, Lower Shore Health Clinic funded. Atlantic General Hospital has had funding from this commission. And with this grant today, we are moving forward on a concept, on a team that works. So for the SWIFT team, when you think about what you all have already heard, and can we get another round of applause for the award that you all just won? That is super. This tells me that when you have everybody committed to the outcome, so we know what the goal is, which is to divert those who are using fire EMS and to take those non-emergency cases and get them in the proper settings. And we have all of our partners here today committed to that and already showing results. So I can look at the commission in the eye and say, we are doing our part, and we are so happy that you recognize that and that you are delivering on this funding today. So thank you to all the partners, and let's get those results. Thank you.
Before I continue, just want to recognize our Vice President of the City Council, Muir Boda, as well. So Delegate Cherie Sample Hughes, do you have a few words?
Good morning, everyone. It's such a beautiful morning, and it's just a great opportunity to be here to spread the good news. I reckon this as good news because, you know, in the rural communities, we have to deliver and address issues at a different angle. And what I will say is this, is that the commission is very much a listener, and they take heed to the action that is needed. I know while I serve in the House of Delegates on the Health and Government Operations Committee, what I'm often hearing is what's going on the Western Shore and what's going on here and there. But what I am able to say is that this is what we need on the Eastern Shore, and this is what it's going to take. And the commission and many partners that are here today have listened and made sure that it's happening. So I'm thankful to be in the position to be able to say, hey, we're doing these things here in Salisbury. We're doing these things in Wicomico County. When I travel around the nation quite a bit, I was in Kentucky a couple weeks ago, all I kept hearing was that Maryland is at the helm. Maryland is a leader, and we're going to continue to serve in that fashion. We're going to continue to put ideas together and bring partnerships together, because as it was said earlier by our chief, that the partnerships is what's going to strengthen our community and is what's going to take us to the next level. So I am very pleased and very thankful to serve on the Health Committee, to be actually the lone Eastern Shore voice on that committee. But when I look out into the audience and see Mark, and he's shaking his head and knowing that these issues are real and knowing how true they are, that we have a partner at that level and many other levels. So thank you again. I wish this team the best because it's going to make our life and our community much, much stronger. Thank you.
Next, I would like to bring up Dr. Catherine Fiddler, Vice President of Population Health for PRMC. She probably wishes that I did not have her phone number because I am constantly in contact with her. I think that we have become partners through this process as well as other processes, and I can't think of a better person to have in that role.
Hi, everyone. I think most of the things I have to say are a repeat of everything that we've heard from Lori, from the police chief, and from our delegates. This is an amazing opportunity. Population health and what Peninsula Regional's mission is to improve the health of the communities we serve is really empowered and enabled and emboldened by the people here, who are operating the SWIFT program. This started, and I have to give a big shout out to Mr. David Fippen. This is a paramedic who had a passion. He said, "You've got to do this," and it was one of the first things. He was the first person on my schedule when I got here over 2 years ago. So he said, we need to change the way we do business, and it is about a partnership. For over 100 years, we've operated a fabulous hospital. We do remarkable work inside those walls, but we know now today we've got to reach out into this community, and it's with every one of you here. It's with the fabulous community that we have. So thank you very much, and I look forward to continued success for this SWIFT program.
And now to hear from our funder, Dr. Alan Anderson is the chair of the commission, and I would like to invite him up for a few words.
Thanks. It's great to be here. I do live on the Eastern Shore. I've been practicing geriatric psychiatry in Cambridge and Easton for 28 years, so I've been here for a while. On behalf of our commission, though, we really would like to say that we're thrilled to support this program. You know, this embodies the Commission's goals of serving vulnerable populations and expanding access. And in doing so, is going to help reduce ED visits and hospital admissions. I will say that this really embodies what we think of in terms of population health. For those of you new to that term, you know, we have a fragmented healthcare system nationwide, and we need to do things to stop the fragmentation and improve healthcare. And I'm impressed with the population health initiatives that are going on in this part of the shore. It truly serves what's called the triple aim, which is providing the best care to the population, not to the patients that walk into your office, to the entire population. And doing so with improving the perception of the patients on the healthcare team, improving their experience. And the last part is doing so with reduction of costs. And this project truly hits all aspects of the triple aim. I know that she's not here today, but I did want to thank Senator Addie Eckert, who's also a colleague and friend. She's, as you know, a mental health nurse by training. And she has been supported the commission, but has supported me as I joined the commission 2 years ago and became the chair last year. You know, the CHRC looks to support programs that are innovative, replicable, and sustainable. And you heard that there's a great plan in place, thanks to Lori Brewster and her team, to look at ways that the state of Maryland can support this program. You know, in population health, we think of things that might cost a little bit up front, but the savings on the back end can be tremendous. And this is an example of that kind of program. You know, the CHRC has supported programs in all jurisdictions of Maryland. We gave out grants over the time of its existence, totaling $64 million. And interestingly, those grantees have leveraged an additional $17 million, or actually $21 million, in additional funding, and out of that total, more than $17 million came from private sources. So we feel very proud at the commission that our grantees are leveraging other sources to keep these programs going. We also support programs in rural areas, and I think this is a third recent grant we've provided to Vincent Regional, to the health department in this area. And so we're pleased that we see some of these programs working and doing well. We've also been pleased to support the opening of a new school-based health center in Salisbury and a care wrap program at the Lower Shore Clinic, which I understand, like SWIFT, also has a partnership with PRMC. I would truly like to thank our commission. You know, we have a great group of commissioners who are well-educated leaders, thought-provokers, but we also have a great staff. Mark Luckner is the executive director, and his two staff do a tremendous job at not only helping us as commissioners review these programs, but putting in the efforts they do to review the programs and keep them pressed to achieving their goals. So thank you, Mark, for your work. Lastly, I would also like to thank Julie Wagner from Care First, who actually serves as one of our commissioners. Care First and the commission have had a long track record of co-funding projects in underserved areas, and public-private investment in SWIFT is just one more example of that. So again, thank you for being here. Thank you for all the folks that are working in this SWIFT program. And the commission truly looks forward to the continuation of these great results that you're producing. Thank you.
Next, I'd like to ask Julie Wagner come up. She's the Vice President for Care First, and as Dr. Anderson said, on the commission.
Thank you, Lori. Thank you and good morning. We're so excited to be here. You know, as the region's largest not-for-profit health insurer, we're not only a health insurer, we really have a mission. And this is the embodiment of it. What you all are doing, what you've started here, really is the embodiment of what we try to do with the dollars that we have. Because our goal is really to improve the health of the entire region, especially those who are underinsured and vulnerable in our community. And what better program than the SWIFT program to do that? I'm here today, I'm lucky to be here with two people who are just really embedded in the shore and who guide us in our work. Our board member, Ellen Waters, and our dynamo, who is all things, sales doesn't really describe everything that Jean does because she really is representing Care First here on the shore, Jean Sewell. Thank you, Jean. But I have an important job today. Care First was so happy last year to provide seed funding for this program. To really see its success is very exciting, and so glad that our delegates can be here today to see what's happening and to celebrate this new grant. And so, you know, it's one of those moments where you get to pull out the big check. I'm going to pull out the big check, and we'd love all the partners, the hospital partners who really make this possible, and everyone else to join us up here for a picture, Lori, correct?